Cases of cholera reported at the Korle-bu Polyclinic is said to be alarming. Currently, 410 cases have been recorded with 6 deaths.
The acting director of medical affairs at the Korle-bu Teaching Hospital, David Nortey, who disclosed this to GBC 24, said more beds and cholera bays are needed to curtail the ever-increasing numbers. Meanwhile, management of Korle-bu says it is fully prepared to contain any reported case of Ebola in the country. According to medical directors at the Korle-bu Polyclinic, cases of cholera have been reported daily since April. Currently, it has 410 cases, and the month of August has already recorded 38, with 16 of them having serious complications. An average of 20 cases are reported daily. Now, the cholera response unit can only accommodate 8 patients at a go, and the remaining are catered for openly at the OPD. The disease control officer at the Korle-bu Polyclinic is Abigail Owusu.
We have 6 deaths. It's only one who died here. The 5 of them, they reported already dead. And they were referred from private clinics. So when they got here, they were already dead. The cholera bay is already full. So that 16 are still at the OPD with their fluids being held by their relatives. For drugs, we don't have any problem. All the logistics are ready now. Fluids, antibiotics, everything is ready for us to use. But the people are still coming. We don't get less than 20 a day.
The acting director of medical affairs at Korle-bu, David Nortey, also called for more public health education to reduce the number of cholera cases.
AMA, as far as Accra is concerned, should be leading the way. I mean, the situation is quite alarming, and the earlier we did something about it, the better.
Meanwhile, the acting CEO of Korle-bu, Dr. Emmanuel Siama, said his outfit is ready to contain any Ebola outbreak if reported. He indicated his outfit has already received protective jackets from the Ministry of Health for those who will work on patients, and called for the establishment of an isolated emergency unit to manage the disease.
Our staff have already been trained. We have those who will do the public health aspect of it, and then those who will actually handle the case management. Now, I have had a few other requests from my staff. They are also asking for an additional insurance cover because they see this disease as life and death if they have to closely go and manage this case should that happen.
The Health Minister, Dr. Kweku Agyeman-Mensah, also pledged his support to help Korle-bu to stand out as the flagship hospital in Ghana.
I'm glad that now the place is relatively quiet, and you have also agreed that the forensic audit should go on. Because what is the purpose of an audit? Audit is to improve efficiency and effectiveness. But in Ghana, when they say, hey, the auditors are coming, then people are shaking. Why? It shouldn't be so. But it should be done with a human face.
The minister later inspected ongoing works for the construction of an ultra-modern emergency response unit to replace the old OPD. The new emergency unit will provide better care for all.